Hey, hi.
Hey, Jody, how you doing?
Good. How are you?
Oh, wonderful. Now that I overcame some of the technical challenges on my end, I'm from a different age group, so I'm maybe a little challenged.
It may be me. My husband tells me that I have magical fingers and everything I touch that's electronic suddenly doesn't work. So,
Gotcha, gotcha. Well, you know what? That combination, you and I, right? So it's okay. So just want to let me just begin by saying, hey, I thank everyone for joining us today. My name is Derek Varner. I'm with the Global Medical and Scientific Affairs team here at Thermo Fisher Scientific in the Immunodiagnostic Division, and also I'm a practicing provider as well. And so what I want to do right now is just turn it over to our guest speaker for today or my guest, right? I'll be facilitating this discussion. And so I would like our guest, Ms. Jody Schrober, to introduce herself, tell us a little bit, and then we'll get started.
great. Thanks, Derek. Hi, everyone. My name is Jody Schroba. I am a board certified nurse practitioner. I was in clinical practice for 17 years in allergy with an emphasis on food allergy. And just last year, I decided to join DBV, which is a research company. So I am now working on the research side of things. But today I am here speaking on my behalf as a board certified pediatric nurse practitioner, and everything expressed today are my own opinions and views. But this is my second time on Allergy Insider, and I'm so excited to be back. And it's so much fun, and I'm just glad that I could be here today.
Yeah, we are too. Thank you so much, Jody. And I tell you what, I'm going to share this disclaimer with the audience. So I would just like to share with you that if after this program that you have any questions or concerns, we would highly recommend you follow up with your healthcare provider to address those issues and those concerns so you can get the best appropriate and timely care. So let's kick things off. I would like to tell the audience that this is actually Food Allergy Awareness Week for 2025. And so we're going to focus our conversation on the oral allergy syndrome. So, Jody, if you would, could you please briefly explain what is the oral allergy syndrome and how it really differs from the typical food allergy?
Yeah. So when I talk to families, and again, remember, I talk to to pediatrics, so I try to keep
Yes.
everything in very simple terms that the kids can understand. And I always like to say to them that our bodies are really, really smart, and they can do a
Okay.
lot of things to make us stay healthy. But oral allergy syndrome is the one thing that kind of tricks our body a little bit because what happens is when you're allergic to pollens, and right now we're in spring pollen season, so all of you
Yes.
allergic to trees and to grass, you're probably sneezing right now. Um, that pollen has a protein, and everything that's living has protein in it. And so with oral allergy syndrome, when you eat certain fruits and vegetables, they have a protein that looks like the protein in pollen. And so it tricks your body, and your body thinks that you're eating pollen. Well, we all know we're not eating grass, we're not eating leaves on trees. We're not eating pollen, but the body doesn't realize that. And so when you start eating certain fruits and vegetables that have the same protein, then your body starts reacting to it. The good and the bad of it is that reaction is usually limited to right around your mouth, in your mouth, and right on your throat. And then that's where the cool part of your body starts kicking in. And when it hits your digestive system, it completely shuts that off and your reaction stops. So it really is a reaction that's only limited to your mouth. So the good news is when you have what we call an IgE mediated allergy, which is what most people think of, like when you say you're allergic to peanuts or milk or wheat, I could go on and on and on. Um, those can be more life threatening or more what we call whole body reactions, meaning you could have a reaction in varying parts of your body, but with oral allergy, it's all limited to that mouth. And so that's really the biggest difference is how the body responds. And that's what's so cool about our body because we trick it when we put it in its mouth, but then once it hits that stomach, it gets all smart again and realizes that this is really no big deal and it just kind of eliminates it with our normal digestive process.
Gotcha. Hey, what a wonderful explanation. And could you touch on, like you said, the oral allergy syndrome, but when it comes to the actual food allergy with anaphylaxis, could you share a little bit about that, how
Yeah.
that differs?
So remember, if you have what we call the IgE mediated food allergies, and again, it's very easy to use peanut as the example because that's a food allergy that most people think of. So
Right.
no respect to anybody's allergy. I'm just going to use peanut as an example.
Hmm.
But like someone who's allergic to peanuts, they're going to eat peanuts, and for sure they could get an itchy mouth. But they're also going to get things like hives, which are like those whelps, like those bumps that you itchy bumps you get on your body. They
Hmm.
coughing, they may start wheezing, they may start throwing up, like really feeling not good. In real extreme circumstances, they could have a drop in their blood pressure. Um,
Yeah.
but and those again are IgE mediated. So those reactions hit your bloodstream, and then that's what causes that whole body reaction. Where when we're talking about the oral allergy, it's just what's going on in your mouth. And so that's kind of the real big difference. One other very interesting difference between the two is if we were to do, say, an IgE, an immunocap, so a blood test on you, if you're
Hmm.
peanuts, you're going to have a, a blood test that's elevated to peanuts. Now, if you eat, let's say, an apple and you get that oral allergy syndrome, if I did a blood test to you to apple, it's going to be normal because your body
Mm.
doesn't realize that it's allergic to it. And again, it's that protein of the pollen that's causing those reactions.
Yeah, thank you so much. Now, you talked about pollens. Let me ask you to help the listening audience. What are some of the to the oral allergy syndrome, and what foods should people think uh, that they think they may be allergic to? What are
Yeah.
some of the most common?
Yeah, so on my end, you froze just a touch there, but I think you were
Okay.
asking what are the common pollens in the foods that go together.
Yes.
Number one is going to be birch pollen, so
Okay.
birch tree. Now remember, let's just quickly talk about allergies in general. When we talk about seasonal allergies, so trees typically, now again, this is going to vary on where you live
Right.
geographically. Your pollen season
Hmm.
may be a little bit different, but for the most part, tree pollen starts about maybe mid-February, beginning of March, and kind of goes until about the end of April, mid-May. Again,
Okay.
based on your geographic region. And
Hmm.
birch pollen is really the number one kind of cross-reactive pollen that we have. And it's going to sometimes that oral allergy syndrome may be worse during that pollen season. So, like, we just got out of tree pollen season, but anyone that's watching this and maybe like a couple weeks ago they were eating apples and their mouth was all tingly and they were feeling because again that birch tree apple is really the most common one, and then a lot of those pitted fruits, so or what some people will call your stone fruits, so things
Mm.
like cherry, peaches, um, even plums, even pears can be a little bit, but really the big one with the birch tree is going to be those stone fruits and apples. Now there are many more that go along with that birch tree.
Okay.
Other common ones, ragweed is very common. And now your ragweed's going to be a pollinator in the fall. So kind of that right when the kids go back to school is usually when ragweed spikes. So if it seems like your kid's getting sick right at the beginning of the season, maybe ragweed allergies, definitely talk to your allergist about that.
Gotcha.
But ragweeds are more common with the melons. So a lot of people will say that they have trouble with like watermelons, honeydew, cantaloupe,
Mm.
um, also grasses. We're just now getting into grass season. Some people may be into it a little bit more than where I'm in the Midwest. We're just kind of now hitting grass season. And so those are going to be like again, melons can be celery, tomatoes. Um, so there's a lot of them, and I will say that Thermo Fisher on their website has a really nice description of the different pollens and the common fruits and vegetables that go along with it. So if you're curious about what maybe some of your triggers, I would definitely suggest looking at that or any of the professional allergy organizations as well.
Yeah, that was great, and thank you for saying that because we will supply that link to you. That way you can take a look at that for the listening audience, and you'll see what those cross-reactive most common things are. But Jody, let me ask you this: is it possible for someone to develop the oral allergy syndrome later in life? And if tell us a little bit about that.
Sure. So, you really can develop that oral allergy syndrome really kind of at any time. Now, remember, we're talking about that this is a problem with your pollen allergies, not with this per se food allergy, meaning an IgE mediated food allergy. So,
Right.
that for most people, if you were to do that blood test, skin testing type of allergy testing, we know that those pollen allergies most develop starting around age 4 and up. So now, parents, you may absolutely start seeing runny noses, watery eyes, itchiness in your children less than 4. But really, testing really starts correlating with symptoms around age 4 and above. So that means that as we get older and those pollen allergies are more settled, then we may start seeing more fruits and vegetables causing issues. Now, the other thing to remember is if you're ever sitting around at home and you're like, gosh, my allergies are so bad, I feel like this is the worst pollen season we've ever had. Um,
Right.
it is. Every year pollen gets worse. So each year you may find your allergies get a little bit worse. You may find there's certain fruits and vegetables that bother you a little bit more than they did when you were younger. Again, a lot of that has to do with the fact that carbon emissions make pollens grow more. Climate change is changing how long our seasons are. So you may notice that I gave a pretty big range there for spring pollen. And that's
You
kind of
did.
bigger because the warmer we get, the sooner the pollen's going to start coming. So that's why you're going to kind of see this like kind of ebb and flow as your allergies kind of develop. So typically, you're going to see that oral allergy in some of those kind of older children, teenagers, adults than say maybe your preschool toddlers.
Gotcha. Thank you so much. Hey, Jody, here's another question. I think you touched on it a little bit, but if one is suspected of having the oral allergy syndrome, how does one go about doing testing? What's all involved with that? Could you share with the audience?
Yeah. So, one thing, and this is kind of a general answer. Um, Anytime you suspect you have an allergy, whether it's food, oral allergy syndrome, pollen allergies, the number one thing you can do is take a history of your symptoms and when they're occurring. So,
Hmm.
if you think that you're having a reaction to apples, write down like what symptoms you had and how you were eating that food. And I say this for any food allergy. So like milk and egg are another fantastic example. Like if you think that you're allergic to those foods or you think your child is, write down like what they ate and what their symptoms were. And then when you go to your allergist, you can give them an accurate picture of what's going on at home. Because remember, when you go see the allergist, you're getting 15 minutes to an hour with your provider to get all of your questions answered. So if you come in with your history very clear and concise, it's
Right.
really going to help them determine what's the right test to do. And I know that we always want to have as much information as we can, and we may just say, I want to be tested to everything.
Yes.
Not what we want to do. We want to really want to narrow it down. So, for example, if someone came into me and they're like, "Hey, I think I'm allergic to apples," and then I start saying, like, "Well, what happens when you eat the food?" And if they say to me, gosh, when I eat a raw apple, my mouth gets itchy. I maybe had a little bit of hives around my mouth. But it was there for like maybe 5 minutes and then it went away and nothing else happened. And then I might follow that question up with, well, what happens if you eat applesauce? Because we know that proteins, their structure changes if we manipulate them with, say, heating or cooking. So applesauce, if they say, "Oh my gosh, I eat applesauce every single day and I'm fine," then there's kind of your leading towards where we need to be going for testing. Where, for example, let's say someone comes in with they say, I think I'm allergic to peanuts. And they say, I eat raw peanuts and I start having hives and I start coughing and wheezing. I eat peanut butter, I get hives, start coughing and wheezing. Well, then we need to think about, we need to test you for peanuts. Where with the apple, you're telling me that you eat applesauce and apple pie, but you can't eat a raw apple. Then kind
Right.
of next conversation with the allergist is probably going to say, do you have seasonal allergies? And kind of go through that. And then they're going to kind of come up with a plan of, we're going to test you for seasonal allergies, not for the apple, And so it's really important that when you go to your allergist, you're prepared with when do you have your symptoms and what are your symptoms.
Gotcha. So with that being said, Jody, and we'll get ready to wrap it up, but this is one question that keeps burning. Does when you talk about the management, once they get the diagnosis, does really peeling, cooking, freezing those fruits and vegetables really reduce the risk of them having that localized reaction? Does that help out?
So for some people, peeling does help,
Hmm.
um, but peeling's not going to help everybody. Um, Heating is truly the best thing that you can do because
Yes.
heating again is going to change that protein structure. So, obviously there's some fruits and vegetables you're not going to cook. I would never eat a cooked watermelon. Um, well, if melons are your triggers, unfortunately, you're going to have to avoid. But for like apples, you can bake them, you can cook them, carrots, any of your vegetables, all of those can be cooked. So you could still eat them in that form. The one thing I want to talk about is freeze dried does not remove the protein. So if you're going to eat that, like freeze dried mangoes, the protein is still present. So you really do have to heat things really to help kind of reduce that protein. For some people, they can take an antihistamine and then eat the fruit or vegetable, but that's not going to work for everybody. So it is really important that you talk with your allergist about what's the best treatment option for you. The other thing that you may want to consider is if you have a lot of seasonal allergies, allergy shots could be a good option for you because you're going to be treating your seasonal allergies. And in return, that may help you bring back some of those fruits and vegetables into your diet
So
as
thank you so much. That was outstanding. And I think this is so important, especially as we get ready to end the school year. There's graduations, there's vacationing, there's family reunions, etc. Right? So we want to bring this education so we could talk to the patients, talk to the caregivers about how to eat safely and address those concerns. So, Jody, is there any last departing words would you like to share with the audience before we close off and end this segment?
well, I would. I did and I may be misquoting here, but I believe I saw a question scroll down about honey. And
Yes,
I would love to just speak on the honey for just one
please.
quick second and just say that so bees are flower pollinators. So they get all of their food, enrichment, nourishment, everything from flowers and not so much from your trees, your grasses, your weeds. So a lot of people want to believe that local honey will help their allergies. Um, and this is what I'd like to say to that. If you take honey and you feel like you are better, then I would say go for it. Like if there are things that are, non-medicinal that are helpful to you, I encourage you to seek those options. However, local honey really doesn't control your food or your seasonal allergies. So really if you're struggling with those seasonal allergies, really going and talking to your allergist about medications, saline rinses if you want a non-medicated option. Again, we mentioned allergy shots. Again, any type of homeopathic, I encourage you to discuss with your doctor, your allergy provider. But again, truly seasonal, that honey that's local to your area is really not going to fully treat your allergies. That is a common question and a common kind of misconception. So I know we probably don't have time for all the questions, but I did just want to talk about the honey. But
Yes.
the biggest thing is, you know, allergies. Unfortunately, we can't always cure every single allergy, but there are really great treatment options available. So really, I would say encourage you to go see your local allergist, your local allergy nurse practitioner, your allergy physician assistant, and just kind of really talk through your symptoms and create a plan that works for what your beliefs and your concerns are. Because really, as a medical community, we're here to help you. And we would rather you come to us with every possible question you have regarding your allergies so that we can give you the most informed information for you to make the correct choices for you and your family.
Wow, outstanding. Jody, thank you so much. And thank you to the listening audience for joining us today. And so until next time, we'll see you soon and we'll try to get to some of those questions and answer those offline. But please do. You can visit the Allergy Insider. That's an open access form. You can look at that. It has a lot of great information for patient education and also to arm you. So when you do go see the allergist or the nurse practitioner or the physician associate or physician assistant, to get that care and seek those answers that you need. So until next time, once again, we thank you so much, Jody, and everyone have a marvelous week. Take care.
Thank
Bye bye.
you. Bye.